Hi, my name is Jessica Sexton, and I'm here to talk to you about medication assisted treatment, or MAT. The CDC states that there were 107,543 overdose deaths in the U.S. in 2023. Yes, you heard that correctly. 107,543 deaths, which they say is a decrease from 2022. This is just far too many. Do you have a friend or a family member that has suffered from OUD? Many of us have been through this in the state of West Virginia. OUD is a chronic brain disease that affects the brain's reward system and the pleasure pathways. Research shows that patients in MAT are less likely to die. Now, we will closely examine how the medications work for MAT. Each has its own unique mechanism of action and it is highly individualized to each patient. First, we have methadone. It's a synthetic opioid agonist, which slowly activates the opioid receptors in the brain. It does not provide that euphoria that they would get from heroin or fentanyl. It has been used for over 40 years and is a great treatment. It is only used in specialized treatment programs and it is administered daily. It can reduce withdrawal, cravings, and it usually comes in the form of a suspended liquid. Next, we have buprenorphine, which is a partial opioid agonist and it also binds slowly to those receptors. It is a partial agonist in the mu receptor and an antagonist in the K receptor. It can displace other meds from the receptors. The best way to explain this is that this is going to fight with other medications like heroin and fentanyl on the brain's receptors, and it'll eventually knock those off. Any licensed physician can prescribe this medication on an outpatient or inpatient basis. This comes as a sublingual tablet or film, patch, 6-month implant, monthly or weekly injection. Next is naltrexone or Vivitrol. It is an opioid antagonist that binds to the mu receptor, which blocks the effects of other opiates. It can be given intramuscularly, oral tablet, after 5 to 7 days of no alcohol or opiates. It decreases cravings by fully binding to the receptors, so it blocks those effects. It's given as a daily tablet or a monthly intramuscular injection. It is estimated that 6.1 million people aged 12 and older have an OUD. Research shows that MAT increases patient adherence to treatment and decreases illicit use. When used in conjunction with counseling, peer recovery, and behavioral health services, MAT is very effective. There are also other non-drug therapies used in conjunction to prevent relapse. Treatment is highly individualized to each patient, and it's not a one-size-fits-all. MAT often uses group counseling, peer recovery, and daily or weekly visits. It depends on the level of care needed by the patient. Studies show MAT decreases risk of relapse by 50%, which is huge. It is approved for both short and long-term use. Some patients need lifetime care. OUD is a lifetime disease. MAT prevents overdose and is used with harm reduction techniques. It decreases criminal activity and decreases the transmission rate of infectious diseases like HIV and hepatitis C. MAT helps increase retention in treatment and social functioning. I've had a lot of patients tell me, I've just got my life back now. I hope you've learned a lot about MAT and patient outcomes and treatment. Again, there are 3 FDA approved medications for use in treatment of OUD, which include buprenorphine, methadone, and naltrexone. They each have their own unique mechanism of action, and it's used in conjunction with other therapies. It's highly individualized treatment, and it works to combat cravings, withdrawal, relapse, and overdose. Research shows MAT is an effective form of treatment for OUD. Thank you for letting me explain options for MAT, and I hope it helps you learn more about this.